First and foremost, thank you so much for inviting me to be here, together with my colleagues, to speak to you about the advancements that we're having on the state level with respect to this new system coming unrolling. I think it's no secret that, we at OASAS know that, safe, affordable housing together with stable living wage employment is fundamental to successful long-term recovery. I mean, that's no question in OASAS. OASAS actually has placed a very high priority on creating and supporting permanent housing and recognizes it as the #1 recovery support. Stable housing options for our clients are essential to our efforts to implement the move of behavioral health services into Medicaid managed care. As a matter of fact, the creation of new housing opportunities is indeed OASAS' #1 priority, as it's evident by the recent awards of 300 new permanent supported housing units as part of the Medicaid redesign statewide, and by this year's state budget funding, which will allow for the creation of 70 additional permanent supportive housing units in New York City under the New York 3 initiative. And, we hope to continue to support more of those housing developments as they become available. Now, as I indicated, the transition to a fully managed Medicaid system for behavioral health provides us the opportunity to develop innovative, patient-centered, community-based services supportive of patients' recovery goals in the community, and it also creates opportunities for us to take advantage of our share supported housing models and the services we view as critical to achieving success in treating, including employment, vocational counseling, and case management services. As we move forward, all care will be integrated in managed care, as all managed care companies will need to qualify for managing the behavioral and physical health benefit through the mainstream MCOs for all patients. Plans may also qualify to manage an integrated HARP benefit for higher need patients. HARP members may qualify for additional support services through a functional assessment and individualized care plan. Health home care coordinators and housing providers will be integral parts of the HARP network of providers. We believe that these additional services will help us stop the cycling of patients through inpatient rehab and inpatient setting and allow them to develop real stability in the community and a much more quality of life, which is what we're all aiming for. The OASAS HARP eligible populations, just in case, let me just tell you who they would be. Members who have had 2 or more inpatient detox stays in the last 12 months, members with 1 inpatient stay, members with 2 or more ED visits or hospital inpatient stays with SUD, substance use disorder, as the primary or secondary diagnosis. So supportive housing providers will have a very active role in care planning, especially for HARP members. There will be additional housing support services that housing providers are in a position to develop. As these services evolve, this will bring greater opportunity for housing providers, such as yourselves, to grow these service models and to become better integrated into the treatment service delivery system. Some of the new services I mentioned will be developed through the Medicaid system and will supplement others like care coordination, which is available to SUD clients through health homes. Some services will not be reimbursable through Medicaid, or patients may not be Medicaid eligible. And OASAS will continue to use the federal block grant dollars and state dollars to pay for these services. So we will have to really restructure the way we do business with our block grant dollars to make sure that we're able to cover these other areas. The growth of the new recovery-oriented services may mean some changes for how block grant dollars and state dollars are utilized, as I indicated. OASAS will ask for approval to bring the entire continuum of care into Medicaid managed care under the rehab model. In other words, being able to provide care outside of the four walls of a facility, more in a community-based setting. So we feel that this will allow for off-site services that will provide better supports for housing providers and allow more creative working relationships as providers will be able to meet with clients in housing and community settings. Additionally, as part of the move to Medicaid managed care, we will look to protect existing treatment relationships, and we will require that managed care plans will contract with treatment providers who are treating their members. We are also working with our residential treatment providers to redesign their model of treatment with a specific focus on reintegration as the final phase of treatment. There will be opportunities for housing providers to partner with these residential programs to bridge patients from that final reintegration phase to permanent housing. As we make the choices as to which plans manage behavioral health benefits, we will seek to raise the bar for managing behavioral health disorders across all plans by ensuring that plans have the experience and competency to manage the behavioral health services in the Medicaid population. OASAS and OMH, in partnership with DOH, are in the process of developing an RFQ process that will ensure that plans are able to meet the high bar for managing the behavioral health benefit. We will ensure that government rates are paid by the managed care company for a transitional period of up to 2 years, and we will work to ensure a transitional period where all providers currently seeing a plan member are contracted with the plan. The MRT plan calls for reinvestment of savings in behavioral health system, and OASAS will look to make new housing developments a priority for reinvestment of these savings. Finally, as we are making this major system transformation, we're also looking at our entire continuum of regulations for all levels of care and plan to create more clinically focused, less prescriptive regulations so that providers can meet the demands of the new market. In conclusion, our efforts will be to continue to develop good and safe housing and really work on those essential links that we need to develop in the system, not only people in the health and human services world, but people outside of our system as well, as Jason was indicating. And we are partners at this very promising time, and I really look forward to continuing to partner with all of you. Thank you.